Calcific pancreatitis associated with alcohol use. As a definition, we could say that pancreatitis is a long-standing inflammatory disease which leads to scarring of the pancreas and irreversible changes. Calcification, which is another sign of chronic inflammation, can develop throughout the pancreas. These calcifications are like stones that are within the tissue itself or within the pancreatic duct. Prolonged overconsumption of alcohol from 5 to 10 years can cause it.
Chronic pancreatitis. Chronic pancreatitis is caused by long-term inflammation of the pancreas, which eventually leads to the irreversible destruction of pancreatic tissue. Chronic pancreatitis develops slowly over time and is predominantly triggered by lifestyle factors in predisposed patients, such as long-standing heavy alcohol or tobacco use, although this is not always the case. Other less common causes are medications that put stress on the pancreas, elevated triglycerides, some autoimmune conditions, and some inherited or genetic conditions, notably cystic fibrosis and hereditary pancreatitis. In some people, the cause of chronic pancreatitis is never discovered and remains a mystery. The pancreas is a digestive system organ that has two important functions. It produces hormones that regulate blood sugar, as well as enzymes to break down food in the digestive tract. When the pancreas doesn't work properly, it affects the body's ability to properly digest food. This means that some people with chronic pancreatitis are unable to get the nutrients they need from the food they eat. They can have trouble digesting food properly or maintaining their blood sugar in a healthy range. This can lead to nutrition-related disease such as weak bones and vision loss. Some people may also have difficulty gaining or maintaining their weight and persistent pain. The hallmark symptom of chronic pancreatitis is abdominal pain. The pain may be intermittent or chronic and is frequently very severe, with stabbing pains localized in the upper part of the abdomen between the belly button and the chest. The pain may radiate to the back and may be triggered by eating, especially high-fat foods. As the disease progresses, the pain may become more severe and debilitating, and often it becomes constant. In some cases, surgery or endoscopic treatment may be required. Oily, foul-smelling bowel movements and weight loss may be seen in the advanced stages of the disease and usually signals exocrine pancreatic insufficiency. As well, depending on the severity and extent of the damage to the pancreas, some people develop diabetes. A combination of tests are used to diagnose chronic pancreatitis. In some people, diagnosis is challenging due to the course of the disease. However, in others, it is relatively straightforward. A CT scan of the abdomen is the most commonly used test. An MRI or endoscopic ultrasound may also be used to confirm the diagnosis. In some difficult-to-diagnose cases, pancreatic stimulation testing can be useful. This test artificially stimulates the pancreas using secretin. This test is expensive and invasive, so it is not frequently performed. Blood tests are not useful for diagnosing chronic pancreatitis. Although there is no cure for chronic pancreatitis, early diagnosis and treatment can help slow the progression of the disease. Treatment involves avoiding triggers, such as heavy alcohol use, smoking, and high-fat foods. Other treatment interventions involve pain management, medication such as pancreas enzyme replacement therapy, PERT, and supporting a healthy diet with multivitamin and mineral supplements.
Application in medicines. A 15-year-old man presented to the emergency department with sudden onset of hematemesis. He reported at 2 months a history of epigastric pain and foul-smelling diarrhea. He had been drinking half a pint of vodka a day for 15 years. Physical examination revealed epigastric tenderness, result of laboratory testing including serum lipase and liver function tests were within normal limits. As a treatment of chronic pancreatitis typically includes pain management and correction of exocrine pancreatitis insufficiency. Also, in patients that have uneventful recovery, the use of pancreatic enzyme supplements and enroll in alcohol abuse rehabilitation programs are essential.
The pancreas is a digestive system organ that has two important functions. It produces hormones that regulate blood sugar, as well as enzymes that break down food in the digestive tract. In acute pancreatitis, the digestive enzymes are activated prematurely and start to attack the pancreas. This causes inflammation, leading to symptoms that are often severe enough to require hospitalization. Alcohol abuse and gallstones are the main triggers of acute pancreatitis. Treatment options for acute pancreatitis depend on the severity of the condition. Initial treatment of acute pancreatitis is supportive. The focus is on resting the pancreas and managing the pain. Since the pancreas is stimulated by eating, food and drinks are restricted, and the patient is put on intravenous fluids to help maintain hydration. Medication for pain and vomiting may also be administered intravenously. Most people who develop acute pancreatitis only require a few days of hospitalization. However, about 1 in 10 cases are more serious and require treatment in the intensive care unit. The kidneys and lungs can be affected, which may require dialysis or placement of a breathing tube. Fluid-filled sacs, or pseudocysts, can also form inside the pancreas. If they become infected or cause symptoms like abdominal pain, gastric outlet obstruction causing nausea and vomiting, or biliary obstruction causing an elevation in liver test, they will require drainage. Surgery is sometimes needed to remove dead or infected pancreatic tissue or tissue around the pancreas. Some specialized hospitals can drain fluid without surgery, using endoscopic methods where the drainage tube is inserted into the stomach or small bowel, or using a percutaneous procedure where a small drainage tube is inserted through the skin. If gallbladder disease was the root cause of the pancreatitis, then the gallbladder may also be removed to prevent future attacks. Most people recover from acute pancreatitis and are offered specific lifestyle advice to prevent future attacks and avoid a chronic or ongoing form of the disease. Patients are advised to avoid alcohol and high-fat foods, stop smoking, eat a varied diet that is rich in fruits and vegetables, and keep triglyceride levels in the normal range. Medications that put stress on the pancreas must also be avoided. However, some people never recover fully from an attack. In rare cases, the pancreas becomes so damaged that it no longer functions properly. This is called pancreatic insufficiency. On rare occasions, the pancreatitis can be so severe that it may lead to pancreatic insufficiency. Diet is further restricted, and lifelong medication, such as pancreatic enzyme supplementation, is required.
As a cons, we could say that alcohol abuse is a well-recognized association of both acute and chronic pancreatitis, with repeat attacks of alcohol-induced acute pancreatitis necroinflammation leading to chronic disease. The risk of developing pancreatitis increases with increasing consumption of alcohol. As a pros is that not all heavy drinkers develop clinical pancreatitis, suggesting that additional trigger factors may be required to initiate overt disease. As a conclusion, we can say that the three major cell types in the pancreas affected by alcohol exposure include acinar cells, ductal cells, and stellate cells. Damage to these cells reverses the acinar cells' death, calcification, and fibrosis of alcoholic pancreatitis, with regard to individual susceptibility factors that may cause over-pancreatitis in some drinkers. Both inherited and lifestyle factors have been studied. Alcoholic pancreatitis is now increasingly thought to be a multifactorial condition, where in addition to alcohol, other lifestyle and inheriting agents may determine the initiation of course of the disease.
There is a sizable gland that is located at the back of the stomach near the small intestine called the pancreas. Its purpose is twofold. It helps in the digestion of food by delivering strong digestive enzymes into the small intestine. The pancreas discharges two hormones into the bloodstream, glucagon and insulin. They aid in the way the body derives energy from its food source. If the pancreas becomes inflamed, it is pancreatitis. When the enzymes used for digestion are activated before they are delivered to the small intestine and it attacks the pancreas, it results in pancreatic damage. Symptoms of pancreatitis. There are two types of pancreatitis, chronic and acute. The symptoms are very different from each other. If you think you may have pancreatitis, it is important to find out which one you have so you are treated accordingly. Symptoms of acute pancreatitis. If you have acute pancreatitis, the unexpected inflammation may only persist for a short period. The illness could show up as a little discomfort up to a serious illness that could be life-threatening. The recovery rate for those with acute pancreatitis is good if